So hello friends, welcome to my new video. So today in this video, I'm going to discuss with you all about a very important topic that we all should know, that is lacrimal drainage system. So I hope you all are familiar with this term lacrimal drainage system. So actually what is a system? So system is a combination of different parts to provide something in an organized way. So, lacrimal drainage system is also composed of different parts which work together to produce the tear film, and a healthy tear drainage system should also be there so that there should not be any abnormality. Okay. So, lacrimal drainage system is the system by which tear can secrete from the lacrimal gland and flow over the ocular surface and drain into the inferior meatus of the nose. So, a healthy tear film is very much important. It is very much important to contact lens wear patient or a normal patient also. A healthy tear film is very important, as we all know that tear film help to moisten the eye, as well as there is a lubricating, it works as a lubricating, and also if there is any foreign body like a sand is get inside to the conjunctiva, that is over the conjunctiva, then with each blink we see that the tear flow to the upper and lower marginal strip to the nasal canthus, so that it flows or it moves the foreign body along with it, so that a proper removal of that thing is also can be seen, as well as this tear film work like it's provide nutrition to the cornea and conjunctiva also. So it is having several functions. So a healthy tear film is very important. So for that healthy tear film, a healthy lacrimal drainage system is also very necessary. Okay, so here in this picture you can see different parts of lacrimal drainage system. So first of all, let's start with lacrimal gland, from where the liquid or aqueous part of tear film is secreting. Okay, so this is the lacrimal gland having two part, orbital and palpebral part, and these are the lacrimal duct. Via that duct, the aqueous component of the tear film is reaching to the ocular surface. Now, as I said that aqueous component, there is other two components are also there. Okay, tear film, we all know there is three layers of tear film: lipid layer, aqueous layer, mucin layer. So lipid layer is coming from the meibomian gland, which is present in the eyelid, and also the mucin layer is coming from the goblet cell present in the conjunctiva. Okay, so when the tear is when the aqueous reach to the ocular surface and making the tear film, with each blinking this tear spread over the ocular surface. Okay, and in the movement of the tear film also noted. So you are also going to learn this thing. Okay, so these are the canaliculi. Okay, and if you just zoom in, and you can see that this is the vertical is called as ampulla and horizontal is canaliculus, and the whole is called as canaliculi. So these two canaliculi, upper and lower, combine together to form the common canaliculus. This is the lacrimal sac and this is nasolacrimal duct, and here this area is inferior meatus, this is the valve of Hesner area. Okay, now from this picture you are going to learn how tear is flowing over the ocular surface. So at this picture, first of all, that tear is spread over the ocular surface. Now tear move to the upper and lower marginal strip and reach to the nasal canthus. And when the tear reach to the nasal canthus, it enter to the canaliculi by absorption and suction method. Okay, and when the when the man close his eyes, then due to orbicularis oculi muscle, the ampullae are constricted, so that there is positive pressure is building inside the canaliculi, and it helps the tear to reach to the lacrimal sac because it is pushing. Okay, and the tear is reaching to the lacrimal sac and it reach to the nasolacrimal duct also. And when the person open his eye, then again the ampullae are dilated, so that there is negative pressure is building in the lacrimal sac, and the tear that were present in the nasolacrimal duct get drained, and now some amount of tear is stored in the lacrimal sac. Now newly formed tear will again come, and this amount of tear will reach to the nasolacrimal duct and it will drain. So this is how tear flow is going on. Okay, So lacrimal drainage system is having two main parts. One is secretory part and another is drainage part. Secretory part, from the name we easily find that this is for secretion, and drainage part, this is for drainage. Okay, secretory part including the lacrimal gland and lacrimal duct, and drainage part which include panta, and panta, that is the two hole that we see in the nasal canthus. I will show the picture. Canaliculi, lacrimal sac and nasolacrimal duct. Okay, so let's start with the lacrimal gland. Okay, so this is the lacrimal gland which produce the aqueous component of tear film. So lacrimal gland, it is an exocrine gland which is responsible for secretion of lacrimal fluid of the tear to the ocular surface. So this gland is situated at the anterior part of the outer aspect of the orbit, and the fluid secreted by the lacrimal gland is the source of aqueous component that I already said, which provide cornea the nutrition, the required nutrition. Okay, and this lacrimal gland is having two parts. One is orbital and another is palpebral part, and these two parts are separated by LPS muscle. Okay, and if I say about the length of this lacrimal gland, it is 2 centimeter, and this lacrimal gland is having up to 12 ducts. Okay. Now another thing is that orbital part is bigger than the palpebral part in the lacrimal gland. Okay, and now if we see here, then you can see that there is a two holes are present in the nasal canthus area. These two holes are called as panta. This is ampullae, this is canaliculus, this is the common canaliculi duct. Okay, and this is the lacrimal sac. Okay. Now if we discuss about the lacrimal sac, this is the lacrimal sac. So you can see this is the dilated part. Okay, in this picture you can see this is the dilated part of the nasolacrimal duct. So it is set on the deep groove at the lacrimal bone, and its function is to act like a tear reservoir and pump tear from inward to outward with each blinking. And if I say its length, then it is 10 millimeter length. Okay, and after that nasolacrimal duct is starting. So if we move to the nasolacrimal duct, then this is the nasolacrimal duct, this is the lacrimal sac, this is the nasolacrimal duct. So it is the end part which carries the tear from the lacrimal sac and help to drain the tear through the meatus. Okay, so if there is any blockage to this pathway, like in lacrimal sac or nasolacrimal duct, then it leads to certain problem to the patient, like patient will complain that excess watering from his eyes, as well as pain or swollen area in that lacrimal sac area or canthus area. That from by seeing this thing you can assess that yes, there is some issue is going on in this part. So your first duty is to perform the syringing to that patient to see if there is any blockage is there or not. Okay, so this is the inferior meatus area, and I also showed you that there is a valve that is called as valve of Hesner. Okay, so what are those causes of watering from the eye? So hypersecretion or defect in the drainage system. So hypersecretion means abnormality in the lacrimal gland, or defect in the drainage system means the lacrimal gland is producing the aqueous component as well as the tear film is producing and spreading over the ocular surface, but due to presence of any obstruction to that drainage area, the tear is not able to drain properly, so that it gets stored over the ocular surface area, and there is symptoms of epiphora is going on. Okay, now due to malposition of the panta, it can be also reason that the pantum are not placed or malposition due to some pathology, okay, or obstruction to any part of the passage. So if we see this picture, then this is the puntal stenosis. Here the panta should be panta is like a hole, but here you see that the hole is closed. So due to this stenosis or constriction of this panta, the tear is not able to get inside this panta because constriction of this puntal face, so that it is leading to epiphora. Okay, now here you can see that the person is having ectropion. So it is called as puntal ectropion. So due to this ectropion, the puntum is shifted forward, so that now the tears are not able to enter here in this punta, so it is leading to epiphora to the patient. Okay, and this is called as conjunctivochalasis. Okay, so this conjunctival chalasis is characterized by one or more fold of conjunctiva over this lower eyelid margin that you will see here. Okay, and this is also conjunctiva chalasis. Here you can see the folds of conjunctiva. Okay, and uh, here you can see that this is the large caruncle. Okay, this is the large caruncle. Due to this large caruncle, the punta is obstructed, so that the tears are not able to drain there properly. So as I said that you should do syringing to the patient who complain of frequent epiphora. So epiphora actually mean excess watering from the eye. So this excess watering can be due to any mechanical obstruction in the lacrimal drainage system, or eyelash in the punta, or lower lid laxity in the older age, or ectropion, as I already said. Okay, so for this purpose you need to do syringing. So this is the lacrimal syringing, and in lacrimal syringing you need to put the lacrimal cannula in the canaliculi, and then you need to press the piston. Okay, so here distilled water is filled, so and instruct the patient to inform you if this distilled water reached their throat. If not, then also the patient will inform you. So by performing this lacrimal syringing, this is also called as patency testing, so you can get an idea that whether there is any obstruction present or not. And suppose you are doing patency test by syringing, so, and water is coming to the upper panta, and you are putting water from the lower panta, and that means lower canaliculi, water is coming from the upper canaliculi, then it indicate there is some blockage present in the lacrimal sac. Okay, so this is how you will get to know that it is a blockage present or not. Okay, and another is dye disappearance test. So this is not dye disappearance test. So dye disappearance test is that you need to put a fluorescent dye in the eye and see by the cobalt blue filter in the slit lamp. Okay, so fluorescent dye disappearance at a specific time, if that fluorescent is disappear from the ocular surface at about 2 minutes, then it is said that the patient is having normal dye disappearance. Okay, and if it take longer than 2 minutes to disappear, then the patient having some drainage issue. Okay, and another testing is that zones one test zone. These are the zones test. Okay, so zones test are one and two. Okay, so in zone 1 test, appearance of fluorescein in the nose after conjunctival installation. So if no dye is recovered, then the test is negative. So here you need to put the fluorescein dye in the ocular surface with the help of fluorescein strip, and then wait for some time, and then put this earbud inside the nose. And if you get this fluorescent dye from the nose, then it indicates that the passage is clear. If no dye is coming, then it indicates the passage is not clear. And in zone 2 test, fluorescent dye is instilled directly to the canaliculi area, and then the earbud is put inside the nose to test is there any fluorescent dye is coming. That is the secondary test. Okay, and another thing is that probing test. So probing test is done with the help of a probe. So here, when you will perform probing to a patient, so if there is no such blockage is there, then the probe can easily reach to the nasolacrimal duct, and there will not be any obstruction. But suppose there is some obstruction is there, then there is two conditions. And at first it can be a hard stop or it can be a soft stop. So you need to feel that what kind of stopping is there. Okay, so hard stop mean that feel so it is a you need to feel that the probe is touching to the medial wall sac and lacrimal bone. So this hard stop is happen actually in the complete obstruction of the canalicular system. Okay, then you will feel this hard stop. And soft stop means a spongy feeling will come. Okay, as the probe presses the common canaliculi against the medial wall of the sac, so at that time a soft stop will there. Okay, another thing is that intubation dacryocystography. So this intubation dacryocystography is done with the help of X-ray after injection of the radio opaque dyes into the lacrimal sac. So and the image will be appear. So by looking at the image you can easily find out that yes, there is some blockage is there or not. Okay, so this is the acute dacryocystosis. Okay, cystosis. So this dacryocystosis actually mean the obstruction of the lacrimal passage from where the tear is draining. So if there is any obstruction, then it will form abscess, there is pus formation. So the patient will have this type of swelling over this nasal area as well as ocular area. So in this condition, after performing the syringing, if it is positive, that means the water is coming from the upper or not going any water, and the blockage is there, then you need to refer the patient to the oculoplastic surgeon, and he will perform the DCT or DCR according to the need, and then the patient can get rid of this type of dacryocystosis. Okay, so that's all friends. Thanks for watching. Please don't forget to like, comment, and subscribe to my channel. I hope you came to know something from this video and you now learned something. Okay, so thank you so much.